Elisha Dacey's 15-year-old is stuck in limbo. Too young to access gender transition care in one Winnipeg program, too old to get into the other.
It was a little frustrating because they were literally right in that sweet spot where they couldn't access care technically.
The Gender Diversity, Affirmation and Action for Youth program, or GDAY, serves those 14 and under. Meanwhile, the Transhealth program provides care to people 16 and up. Dacey's child is now on the waitlist for that program.
We've been put on waitlist after waitlist, and we still haven't got where we need to be.
The clinics each have 300 patients on their respective waitlists, many patients waiting between a year and 2 years. Now, the care that they receive when they're in includes mental health care, access to hormone replacement therapies, and surgeries. Now, this spring, the province offered over $1 million to help the clinics tackle the backlogs. GDAY opened in 2011, but never had formal funding. Specialists like Dr. Megan Cooney essentially worked on their GDAY duties on the side of their desks.
It's been challenging to work in the system knowing that the wait list is as long as it is.
The money from the province is helping GDAY hire dedicated staff, including a psychologist and social worker. Cooney is most excited about how those resources will help children stuck waiting.
Gender-affirming medical care, and specifically gender-affirming hormone medications when they're indicated, they improve health and wellness and they decrease suicidality.
Over at the Transhealth program at Clinic, Haran Vijayanathan says he's seen how long waits can pose a huge challenge to patients, especially when they don't have support in their lives.
They want that process started because there's a lot of psychological and emotional trauma that they're experiencing because that process hasn't started.
He says Clinic is also using provincial funding to hire more staff, but he says ultimately they need stable funding. Dacey agrees.
You have to have permanent funding. There has to be some sort of knowledge behind it that you will be supported no matter where you are in your journey.
Bryce Hoy, CBC News, Winnipeg.